Then there is the neuroimmunology. We're talking about MOG antibody disease, MOGAD. And again, this is how should we treat patients who have underwent an episode that has been diagnosed as MOGAD. Should they be treated continuously, or after recovering from this first episode, is it enough to wait until the second one comes before we go on? There's also the issue of the approach to patients with myasthenia gravis. So we're now in the new period of the FcRn monoclonal antibodies, and this is an important new development. And again, we're going to hear from experts in the field of whether the treatment should be started immediately or only after a late stage in terms of treating these people. Then there is a question of TNF alpha inhibition. Again, another important issue that we are going to discuss. In talking about myasthenia, so we know, of course, we always measure anti-FcRn receptor antibodies. Is the level important? When we treat patients, should we look only at the clinical manifestations, the improvement by these drugs, or should we also measure quantitatively and apply the results of the antibody levels to these people? Then let me move to Parkinson's disease. In Parkinson's disease, there is a debate whether there is a need to redefine Parkinson's. How do we define Parkinson? And of course, there is no pathological definition of Parkinson's disease. We know that synuclein is involved in most cases, but should we look at Parkinson's disease as necessarily being a synucleinopathy or not? What are the outcomes of the genetic studies that show that people with Parkinson's disease may have different underlying genetic mutations? And of course, should they all be treated in the same way or not? Then talking about genetics, so glucocerebrosidase as a target for intervention in PD. What should we do with this enzymatic activity? Should it be increased or inhibited, which is an important issue. Now, about patients who have tremor predominant Parkinson's disease, there are new treatments now. They don't necessarily have to get all the usual levodopa drugs. They can be treated by focused ultrasound, and the question is which one is better, and so on in Parkinson. And we can move and talk about the definition of Parkinson. Is olfactory loss helpful in diagnosis Parkinson's disease? When should we start COMT inhibitors, early or only late, when the complications occur, and so on and so on. In multiple sclerosis, there is no dependable measure to assess whether disease-modifying therapies work in chronic progressive MS. Is that true, or do we have a handle, and can we tell which interventions are important? And whether the optic nerve lesions should be included as an inclusion criteria in the diagnostic criteria for Parkinson, for multiple sclerosis. In Alzheimer's disease, we have a lot of things. For example, do the biomarkers that we have, are these important in identifying individual patients with dementia as having Alzheimer's disease or another type of dementia. Does the existing evidence support the study of anti-tau immunotherapies in A-beta in Alzheimer's disease? We know treatment of A-beta are not very effective. Will anti-tau therapies be more effective, and which are now being in development? Should we perhaps aim at ApoE as a therapeutic target? So patients people who carry ApoE epsilon-4 allele are much more likely to develop Alzheimer's disease than those who do not. Is there a way to help those people who have the ApoE epsilon-4 allele not develop the disease in the first place, or ameliorate, slow down the effect of ApoE4 in some others? Then there is an interesting question of what do we do when patients who are included in our clinical studies, if the clinical studies, the industry suggests that or finds out that it's not really very effective and maybe it should be stopped. Is this ethical, or should we allow patients to continue the treatment if they think that the treatment was helpful in their cases? And then what happens if we see patients who have atypical dementia? Does this predict or indicate that there is an underlying mixed pathology in these patients? Quite a lot of things are happening in the world, and and you can learn, of course, from lectures, but the way to learn briefly, intensively, is through a debate, a pro-con debate, in which each of the speakers dictates their stand. And so the audience comes out of the debate understanding what are the real issues and how to handle the problems.